Last year, Milwaukee ad firm BVK landed an $8 million contract to encourage people to sign up on the New Mexico Health Insurance Exchange. One reason it got that contract was because it had a local partner firm, but it then ended that relationship. Now, according to a survey by Research and Polling, the advertising campaign did not go well. Only 11% of uninsured adults eligible for plans on the exchange bought them, and more than half didn't know what the insurance exchange even was. An official with the New Mexico Exchange estimates there are 80,000 people the campaign missed who make too much from Medicaid, but who are eligible for subsidies to buy health insurance. Now, the Exchange Board recently awarded BVK a new contract worth $6 million. And Tom, there's a lot of criticism last year about this. We had a brilliant discussion right here at this table, as a matter of fact, about this contract letting out to this firm in Milwaukee. It's tough to judge the effectiveness of campaigns. You do this all the time. It's still early days. But where do these numbers, what do they say to you? What happened here that so few people even know about it?
You know, I mean, just looking at it, it was a system failure.
Yeah.
And because when you have a $7 million campaign or a $6 million campaign, when it gets over $500,000, one of the first things you should always do is just research. You know, find out what's going on in the state. And the first research that was done was not until after 6 months, or actually 8 months after the fact. So, you know, and I think that's one reason they missed it, is because you have an out-of-state company trying to assess what the needs are in New Mexico. Now, granted, the BVK had and still has access to New Mexico contractors, folks who know the state, very good professionals. But when you don't base, you know, your assumptions on research, you're just basing it on, I think this might work. And I think the Health Insurance Exchange got exactly what they wanted to get, because they didn't demand that research be a part of that process.
Interesting. When I come back to that research bit, and here's what's interesting to me when I think about this is we think about we missed 2 cycles of our legislature to sort of figure this out. And the health exchange folks got a late start, because basically the legislature didn't give them the go signal until that last session, which left them about 4 months to get this together, 6 months, I should say, to get this together. Is that fair enough? Should they be given a bit of a break here because of that time crunch?
I don't know that they should be given a break because of the time crunch, because you're hiring somebody, paying a lot of money to deliver a product, which is minds that will then buy health insurance. And it seems to me that one of the things that we do in New Mexico too often is we always think that the best person is 4 states away.
Right.
And I just think that in a state that's noted for its creative economy, for brilliant ad people, for brilliant marketing people, and for people who can make commercials and do all of those things, that we need to spend that money at home. I do have this somewhat optimistic point to make, though, is that we used to have 20% uninsured, and it's gone down to 15%. And we are one of the states that has made a dent in its uninsured population. So something is working, whether they have an awareness of it or not. Some people at least are buying insurance.
Sure. Just put a little nuance in what Inez talking about. We've got Medicaid versus the exchange. And it looks like the numbers are breaking literally towards Medicaid in huge numbers here in this state.
And that is largely a function of the economic state of the state, the way that people's own income works out. One thing I want to point out, and Inez sort of started to touch on this, is, so we're talking about 15% of the population that's uninsured. This survey that the Albuquerque Journal sponsored really looked at that 15%, and of that 15%, a smaller percent had not heard of the exchange. It said, I think we have to put this in context, because up until this poll, what we were hearing was that New Mexico had actually done quite well in enrolling people in insurance. And so we want to I think we need to take a step back and say, what are we really looking at? Any marketing professional, I teach marketing at the Anderson School, any marketing professional will tell you that there's a lot of noise, and people are very selective in when they choose to pay attention to messages. So there may be people out there, and not necessarily in defense of the firm, but there may be, I would expect there are people out there who saw those ads, who heard those messages, and filtered them right out. That's not necessarily a failure of the campaign. It may be that that person's not in a place to receive that message at that time.
I'm going to pick right up on there, Russell Contreras, because one of the things that's been pointed out is the folks that are the most difficult to insure, so to speak, really didn't quite get the message or even hear about it. And my conversations I've had with folks over the past couple of weeks is, how did you think a television campaign was going to reach these folks? You got to have a much more warm flesh-on-flesh meeting, talking with people in their living rooms, kind of a thing. You know, does that make sense in your
Exactly. I want to know, you know, where do they go in the pueblos? How do they? What was the message? How was the cultural message? Why this is necessary? As we talked before, about the translations of the sites. Those were always problematic, even our local exchange sites. And then when we wrote pieces that were critical, the administration pushed back and said, well, no, you don't understand. Actually, prima does mean premium. It does. I said, yeah, but also here in the South Valley means cause. I mean, it's just the way it is.
you go. Yep.
Under that dichotomy, you're going to have some resistance because you're like, well, maybe they don't actually understand me. Why should I give them some my money for some health care, even though I mean intellectually I know I need it.
Sure.
So there wasn't that connection. I think that some of these folks didn't see what was the benefit for it,
Right.
and how they should obtain it.
Those are two big things. Those are two not small things there. But I have to come back to this though, Tom Garrity, because something missed. I'm not sure if it's fair to call it a failure, but something very much missed here when you look at these numbers. And if the goal here is just to get folks insured, why don't we put more of our efforts on the Medicaid side than on the exchange side, if that's where things are breaking?
Well, it's, I think Russell, Russ brought up some great points as far as, really connecting with your audience is what it really comes down to.
Right.
But then, to your point though, it's really what's the goal?
Right.
Was the goal to increase Medicaid, Medicare? No, it wasn't.
Right.
It was to reach the most vulnerable populations. And the most vulnerable populations, really respond best to face-to-face contact.
Right.
And that takes a lot of work. It takes $6 million worth of work.
That's right.
And spending money on fancy songs and ad campaigns is going to totally miss this very unique target audience.
Right. I had a bit of an issue with the band. I'm glad you brought up that band. I didn't see the benefit of that. One of the things that's interesting, my colleague Megan Kamrick hosts our Public Square show here, and they had done a segment on this, Inez, a bit ago, and one of the odd quirks about our system is we're pitching both the Medicaid and the health exchange thing at the exact same time, but not recommending either to either one, just sort of an education thing. It seems to me something got left off there, and maybe it's where Tom was getting at, the systems problem. It was too complicated for people to internalize or something. I'm curious, with $6 million, do we just back up and start over again? What do we do from here, I guess is my question.
Obviously, if they've spent that much money, they have to have an idea of what does work.
Yeah.
So they're
That's a
going to
good
have
point.
to spend the money now going after the hardest to get people.
Right.
And I do know, for example, at the Pueblos, if you went to a feast day this summer, you saw the booth to sign up for health care insurance.
Okay.
I saw that, at several places.
Sure.
So they're going out in person, so that's hopefully working. Then you have to go back and make sure that you're reaching the different groups. Are you targeting a northern New Mexico Hispanic villager the same way you're targeting someone who lives on the border? What are you doing on the eastern part of the state where you might have people who hate Obamacare and hate the government and don't want to sign up for anything but are eligible to get a subsidy? So you've got a lot of different audiences, and now you're going to have to hone your message and go out in person and really do the hard work.
Right.
But I hope that the board that oversees this contract has some guides so that they can say, you're not doing it, we're going to fire you and
Sure.
get somebody who can, because really, with our economic situation, as bad as it is, the money that we spend needs to help New Mexicans.
Right.
And
Good
if we're
point.
not doing that, either in getting them to sign up for health care or paying for New Mexico jobs, then we need to rethink how we're spending our money.
Well said. Premiums, costs, that kind of thing. There's some sticker shock that came for a lot of folks.
I'm so glad that you brought that up because I think that there's not just the element of sticker shock, but there was also a persistent drumbeat, and it feels to me like it's died back a bit, but a persistent drumbeat in the national media and to a certain extent in the local media about sticker shock.
Yeah.
And sometimes when you went a little further, it was like, oh, well, yeah, I hadn't actually been to any of the websites. I don't know how much it will cost me. And then it's not as bad as I think it's going to be. But there was a great deal of counter-programming during the time that these messages were rolling out. My hope is that more and more people are now able to say, well, okay, so here's what really happened for me, and to provide a more realistic sense to their friends and family of what it really looks like to have that insurance.
But on top of that, Russell Contreras, is also the idea that you're part of a community. You hear things from other folks, you hear the sticker shock thing, you hear other stuff. But there's that critical next step Sophie's describing, where someone has to sit down with you and say, look, here's the subsidies. Here's where you can save a bunch of dough to cover your family. If you never have that conversation, you're not going to make a decision. So something needs to really be much more vigorous here, it seems to me.
Exactly, because one, these families are worried about their water bill.
Sure.
They're worried about electricity.
That's right.
They're worried about, the coming school year. There's a number of factors going in. And it is stressful to sit down and look at the plans.
And we don't like to talk about money,
We don't
our
like to
own
talk about
money in that
No,
way,
we
yeah.
don't. It's almost
point.
like putting someone aside and saying you need to think about your retirement, you need to think about your funeral
much are you
plans
saving, yeah.
for your family. I mean, we don't want to have that conversation.
That's a very good point there. Coming up, the revenue picture is looking up for the state.